Okay, so we're just getting started on the right shoulder. We've already shaved a little bit of the rotator cuff tear, but I wanted to show you before we get into the subacromial space. This is the biceps tendon on the right side of that blue cannula. It looks fine. The anchor's a little bit frayed, but not bad. It's not loose. It's not what we call a slap lesion, so that's good. It's a little bit of extra surgery that you don't need. And then as we look towards the back of the shoulder, we can see the glenoid here has a little bit of wear and tear changes, but again, not bad at all. Main thing that's remarkable here in the posterior shoulder is the capsule is just very inflamed. You can see all the blood vessels and see how vascular it is. Just a sign of inflammation, probably from the rotator cuff injury. And then same thing when we look down the front, some inflammation, but otherwise pretty good. When we look at the humeral head, I do not see a lot of loss of cartilage, which is another way of saying I don't see a lot of arthritis. And then here's the rotator cuff tear. You can see that hole. So we're going to get to work on that in just a minute. We'll go down on the video and come back up on the video in just a minute. Okay, so here's the tear right in front of us there. And we're going to take a spinal needle and just plan our suture anchor placement, which I think is going to end up being right about there. That looks pretty good right about there. So it looks like it's going to be a one anchor repair. There's the posterior extent of it. Up here we can see the anterior extent because there's the biceps tendon right there. And so we're going to place one anchor down right there. So we'll take a scalpel and then we'll put in a guide. Sorry, we'll get the picture set up. There we go. And now we want to put the anchor just off the edge of the cartilage there. So we'll put the anchor down right about here. Go ahead and pull that. Watch the water. Have the anchor ready to go. And then we'll mallet this down. We'll show you some more in a minute. Okay, so we've got the anchor and you can see it right there. We're going to reach in here and take out one of the sutures. Okay, that solid blue one. Try and focus a little bit better for us too. There we go. Okay, so our first stitch is going to come in from this direction. I need the straight crescent. Okay, so we're all done. We've placed one triple loaded anchor. We've repaired that cuff down. The hole's eliminated. And we're going to get you back to the recovery room shortly, okay? But that looks like it's moving together as a unit. I'm happy with that. So good luck to you now. Bye-bye.